Assalamu alaikum, everyone. My name is Aneesa Husain. I'm the Vice President of IMANA, and I just want to welcome you all to one of our next lecture series as part of our Health Education Committee here at IMANA. We are very fortunate to have Aneesa Husain here to talk about a very important topic for us. Just as a quick note that IMANA Education is working on a lot of different topics and trying to bring relevant health information to our communities and to our providers. So be on the lookout for future webinars that we'll be hosting about future topics, inshallah. It'll be posted on our website. So the topic for today is urinary incontinence and its implications on wudu. Urinary incontinence obviously is a very prevalent issue that isn't talked about a lot, especially in our communities. And so that's why we felt this was an important topic. So thank you again to Aneesa for educating us about this, inshallah. So just as a quick bio on Aneesa, she was born and raised in Dallas, Texas. She completed her undergraduate degree at Southern Methodist University in 2007 and her Master's of Physician Assistant Studies at Texas Tech Health Sciences Center in 2012. After receiving her PA degree, she joined an independent practice in Austin, where she spent 3 years doing general urology and assisting in the operating room. She currently practices at USMD Urology Cancer Center in Arlington, Texas. In her spare time, she enjoys staying active, eating, sewing, and spending time with her friends and huge family, mashallah. So without further ado, I'd like to introduce Aneesa Husain to talk to us about this topic. Thank you, Aneesa.
Thank you, Mariam. Assalamu alaikum, everybody. So as Mariam mentioned, we will be discussing urinary incontinence and its implications on wudu. And this is a very common thing that happens to people. And I just wanted to kind of start out by saying, probably not going to be something maybe some of our listeners are going through right now, but we all will get older and experience this at some point, and it can be relevant at this time to pass on to parents, grandparents, relatives. So a lot of people can benefit. So we'll go ahead and get started. So incontinence basically is leakage of urine. So that's like how people will refer to it when they come into the clinic. They come in and they say, I've been leaking urine. It is defined as the involuntary loss of urine or stool, or the inability to hold urine or stool. Stool is probably, it's going to be about, the same kind of recommendations as urinary incontinence when we talk about how it relates to wudu. So I will be referring to incontinence in the urinary context for this webinar, but the application and the recommendations can certainly be applied to fecal incontinence or leakage of stool, as well as other medical issues that are similar. It's common, nearly 10 million people suffer from this. I think the number is actually even higher than that. And it is more common and increases after age 70. Women experience incontinence more than men. About a quarter of women after the age of 70 will have some form of incontinence. And it can be progressive in the sense someone may start out having frequency or urgency that they have to go to the restroom, and that may last for a few years. And then maybe a decade later, it can progress into actual leakage. Sometimes people say, well, it's pretty mild. I don't have to wear any pads right now or briefs. But over the years, as we get older, it may get to that point where someone needs to use those types of protective things. We'll go over some anatomy. So to the left here, we just have an overview of the urinary tract. So kidneys are up here. Our kidneys produce the urine, and the urine then gets collected in what we call the renal pelvis, which is right where my mouse is pointing to. And from there, the urine goes down through the ureters. So these are the tubes that carry urine down to the bladder. And the urine empties here into the bladder and is excreted out here through the urethra. So more specifically for female and male bladders, there is different anatomies. So I am going to go through that real quick because it will we will be coming back to this as we go through the presentation and kind of learn about how and why incontinence occurs. So the female bladder is a little bit more simple in the sense that it's basically the bladder here connected to the urethra, which is the part that we actually urinate through to get our urine out. And this area, the urethra and near the bladder, is surrounded by our pelvic floor muscles. A good way to think about this is kind of like a bowl of muscles. And that's where our bowels sit, it's where our bladder kind of sits, and that's what we contract and relax to urinate. So there are two sphincters. Sphincters are the control mechanisms. We'll go through each of those. There's two sphincters. One of them is involuntary. Our body, basically takes care of it. The other sphincter is voluntary, meaning we control that. So consciously control it. So the internal sphincter is located right over here at what we call the bladder neck. This is the involuntary sphincter. So this is our body's getting signals, telling the bladder it's time to empty, it's time to not empty, and we don't feel that sensation. This is made up of a different type of muscle called smooth muscle. And as we go further down right here, this is referred to as our external sphincter or the voluntary control. So this is what, when you have to go to the restroom, this is what will open and close to allow you to do that. So this muscle is different and it is made up of what we call skeletal muscle. It's the same type of muscle that's like in our arms and legs and allows us to move. So the female urethra is about 1.5 inches long, so 3 to 4 centimeters. So it is significantly shorter than the male urethra. And that does have certain implications when, we discuss types of incontinence. Women do have higher prevalence with a certain type of incontinence that we'll go over later. So the male bladder is similar, except for men have an organ called the prostate, which sits right below the bladder. And it is a reproductive organ. So the purpose of the prostate is to produce semen. And as men get older, the prostate will enlarge. So it'll enlarge from the outside right here. So when we do a digital rectal exam, we can usually kind of feel the prostate and get an idea of the size. It more importantly enlarges here in the middle as it surrounds the urethra. And you can just imagine, it kind of, I tell people to think of it as kissing tonsils. It can enlarge so much that it may even close off the urethra. And so that can cause urine to build up in the bladder. And as you can imagine, if your bladder is full with urine, you're not going to have much control and it can leak out at some point. So men also have an internal and an external sphincter. Same locations, or similar locations, I should say. So the internal sphincter right here at the bladder neck, again, that's the involuntary one that we are not aware of that controls urination. And the external sphincter, which is located down below the prostate. And this is what you will control to void or not void. So the male urethra is about 18 centimeters long. And we'll come back to these images. There are certain surgeries and treatments to the prostate that can significantly affect these sphincters in the male anatomy. So the bladders, both male and female, hold about 400 to 600 milliliters of urine. So that's considered a full bladder, which is about 2 to 3 full cups. Some people, you'll hear people say, I have a small bladder or I have a large bladder. The size of the bladder is pretty, relative to your habitus, to your size. But when people say they think they have a small bladder, it's mostly because they're probably having constant spasms of the bladder that make them go to the restroom frequently. It's not necessarily that the bladder capacity is lower. Okay, so there are 3 main types of incontinence: stress, urge, and overflow. So we'll go through all of these. I didn't put it on here, but there is something called mixed incontinence, which is a combination of stress and urge typically. So, people can have one, or they can, definitely have a combination of these things. So stress incontinence is leakage with physical movement. When patients come in, we'll usually ask them, they tell us, well, I have leakage. And then you'll ask, okay, so do you have the type of leakage that occurs when you move, if you cough or laugh or sneeze, if you're exercising? And so if they have that, they'll answer yes. A lot of people who, do heavy lifting and straining at work, for instance, they'll notice it more during work hours. Sometimes when people have like a cold or allergies are bad, they'll notice it more when they're coughing and sneezing. So there are certain times where incontinence can worsen. Stress incontinence is the most common type in women, and that is usually due to childbirth and just going through pregnancy. The weight of pregnancy can affect the pelvic floor muscles, and vaginal deliveries in particular can disrupt the pelvic floor musculature as well. This is something that I commonly see in men who have had a recent prostate removal for prostate cancer. That's just a large amount of my patient population and what I see. So that's just what I encounter in the clinic. But this is a type of leakage that occurs with that surgery. And that will occur because we are removing the prostate right here. And in order to do that, we do have to incise into the bladder to some degree, as well as, so that will disrupt that internal sphincter. And then down here, we have to excise, and that will disrupt the external sphincter. As we'll go over later, that's temporary. Strengthening the pelvic floor musculature will help manage that. Okay, so urge incontinence is when someone is telling you that they can't get to the restroom on time. So they have that gotta go feeling. You've seen the commercials on TV for all those medications. This is what that's referring to. It occurs with the urge to void. These urges can happen pretty suddenly. So it's not that, someone has an urge and then, half an hour later needs to go and leaks. It comes on pretty quickly when you have this issue. And if they don't make it to the restroom in a matter of seconds, they're probably going to leak on the way there. All right, so overflow incontinence is due to having a full bladder, and they do not get the urge to urinate. So some people may have a full bladder and they don't even realize it because they don't have that urge to go. What happens though is the bladder will get so full that the urine has nowhere to go but out, and so it will leak out. This is pretty common in elderly people, those that have dementia, just because the sensation is affected with the nervous system, and memory loss, can affect knowing whether or not, you have a full bladder. People who have nighttime bedwetting often have overflow incontinence because, again, at night they're not getting that strong enough urge to get up and go. Okay, so why does it occur? So lots of factors. Some are specific to men and women. Some, are kind of relevant for both genders. In women, we talked about childbirth. Vaginal delivery has a higher incidence of stress incontinence over C-section. Someone who has had like a prolonged labor over 10 hours or had a high birth weight child greater than 10 pounds, that can have an effect on that pelvic musculature, just causes it to weaken and thereby, weakening control. Women can also have something called bladder prolapse, which is also due to weakening of the pelvic floor muscles and childbirth. This usually occurs later, around menopause time, and it refers to the bladder kind of dropping into the pelvis. When the bladder drops, it can retain urine, and just because it's retaining urine and not in the appropriate anatomical location that it should be, leakage can occur because of that. And going through menopause and having loss of estrogen, decreased estrogen will thin out the urethra for women. And just that type of change, can result in loss of control and sphincter tone. So for men, BPH stands for benign prostatic hypertrophy, which it basically means enlarged prostate. Again, that's a normal occurrence that happens as men get older. It is hereditary, so if their fathers had a difficult time urinating, most likely it's because they had large prostates, and that does get passed down. Prostate cancer treatment, surgery or removal of the prostate, and radiation for prostate cancer can affect those sphincters. We had gone over that earlier. Just overall, neurological issues, stroke, neurogenic bladder, which is basically a result of certain issues like multiple sclerosis, stroke, sometimes Parkinson's disease as well. So these things affect the central nervous system, and the bladder is innervated by nerves. It is something that gets signals to know how to act. And if those signals from the nervous system are disrupted by things like stroke, dementia, Parkinson's disease, even spinal cord injury, the signals to the bladder will be inappropriate and affected. So about half of stroke patients initially will have some form of incontinence. It's usually temporary, so when they start to regain some nerve function, they do notice that the incontinence improves as well. And in Parkinson's disease, it's mostly overactive bladders, so they usually have the frequency and urgency just because their bladders are kind of getting those unwanted contractions. That can, however, lead to leakage. Diabetes, very, very common, and especially in our population, we see it quite a bit. The reason diabetes can contribute to incontinence, there's a few things. The main thing would be nerve damage. So as some people may know, diabetes can affect fingertips, toes, and that's just because there are nerves there, and it attacks the ones that are at the ends of our bodies, what we call peripheral neuropathy. But it can also affect organs, and organs that are innervated by nerves, such as the bladder. So that's something that can be caused by diabetes, as well as, there are several patients who have diabetes who also have obesity, and just general weight gain and obesity because of the weight on the pelvic muscles can cause leakage. People at diabetes are also at higher risk for urinary tract infections because of the depressed immune system that goes along with it. And urinary tract infections can cause increased incontinence if someone already has it, because the lining of the bladder gets so inflamed that it will spasm, and that spasm will cause leakage. And then this kind of goes along with the neurological issues, but age-related dementia. This is due to memory loss. The coordination and motor function in these patients is also affected. So just getting to the restroom, knowing that they need to go to the restroom can be an issue. Undressing to go to the restroom, that can be an issue as well. So all these things may result in leakage. So treatment and management is very important in this situation. The main risk of not treating incontinence is UTIs, or urinary tract infections. And this is especially important as people get older because it can increase into a kidney infection called pyelonephritis, and it can also affect their mental state. So our older patients that get infections, you'll hear from their family members that they're not acting right, they're not acting like themselves, and you kind of know what it may be due to when they say that. So it is dependent on type. So we went over the different types of incontinence. So some of these things I'll go over will be specific to one type versus the other. You always want to manage the underlying conditions first. So, as strictly as you can manage diabetes, they should do that. Parkinson's disease, they can control that as best they can with medications, working on rehab after, a stroke has occurred. So you want to kind of start there. Lifestyle changes are the next thing that we recommend. So there are certain foods and drinks that can contribute to overactive bladder and incontinence. If you or whoever the family member is eating or drinking any of these things, work on reduction of them, and that should help reduce the amount of leakage. Caffeine is a very common one. Coffee, tea, soda, acidic juices, citrus fruits, tomatoes, and spicy foods, which I'm sure a lot of our audience is used to eating. So it's difficult sometimes to tell. Again, this is prevalent in the elderly, and it's difficult to tell them what to do, what not to do. But as much as you can, start here. Timed voiding is when we instruct patients to go to the restroom at timed intervals, usually every 2 to 3 hours. So it helps by keeping the bladder empty. So even if you don't have the sensation or urge that you need to go, just go to the restroom, set your alarm on your phones, and as long as you go to empty your bladder, the likelihood of leakage is lower. We try and implement this a lot for the people who have urge incontinence or the overflow type. Mostly in overflow, they don't get the sensation or the urge they need to go, so it's good to just keep an interval of time where they're just going to the restroom. Pelvic floor exercises, also known as Kegel exercises, or Kegel exercises are a type of pelvic floor therapy. These are done to strengthen the pelvic floor. So when we looked at the image that I had shown earlier, those muscles, let's see if I can go back to it real quick. So these muscles right here are very closely connected to the sphincter. And the more we can strengthen those, just like other muscles in our body, the better control and strength we'll have in the urethra. So there's very specific ways to do those. Sometimes we even refer people to go see a physical therapist that specializes in that. They're very helpful for people who cannot take medications due to side effects or nothing else has worked. They are not candidates for surgery. This is a great, therapy for anyone to do. Pads, liners, and briefs. These are important to use and to change frequently when soiled. At the point where someone's using a brief or a diaper, their incontinence is going to be pretty significant. So it's just important to change out of these as much as you can, just because if you think about it, a soiled brief, it's going to be kind of a breeding ground for infection if it's not changed frequently. So there are certain medications that can be used for urge incontinence in particular. Medications do not work usually for stress or overflow incontinence as much. So they are geared to relax the bladder spasm that occurs with urge incontinence. And so those are good for that. I forgot to mention pelvic floor exercises and timed voiding are going to be the two main things for the stress leakage or stress incontinence, along with surgery. So surgery is done right at the level of the urethra to give it support. There's different types of surgeries that can be done for this. If someone is at a point where they need that, we will usually refer them to a subspecialist. In our group, we have a pretty large group of subspecialties, so we have an entire incontinence department that takes care of these things. And then lastly, catheters can be used to manage incontinence. It's not the very first thing, it's kind of the last thing we recommend, or I recommend if none of these other things have worked or are not indicated for therapy. There's different types of catheters. There's external catheters, there's internal catheters. For some people it does, give them some peace of mind and help a lot because they just don't have to think about it then. And the catheter can get changed out every few weeks. All right, so just a disclaimer, I am not a scholar. There may be some things that I don't have the answer to. I can certainly find the answer if someone does have a question later regarding the Islamic implications. And there's also, as with many things in Islam, there can be a difference of opinion. So with different schools of thought, this is going to be based on the teachings of the Qalam seminary. So that is a Hanafi school of thought, and that is what I follow, and that's what I will be speaking on. So just a quick review of what wudu consists of. So we always start with our, intention. I will come back to this because I think in the context of what we're discussing, it's very important. And then, we say Bismillah. You'll wash both hands up to the wrists and between fingers 3 times each, right then left. Clean teeth, rinse your mouth with your right hand 3 times, rinse your nose with your right hand 3 times, wash your entire face 3 times, wash both arms, right and left 3 times. We wipe over our head and ears, and then we wash our feet up to the ankles between the toes 3 times, right and then left. So what do we need to do wudu for? To pray our 5 daily prayers and other prayers. We are touching the Quran, so the actual Arabic text, you need wudu for that. And then when we do the tawaf for Umrah and Hajj. The wudu itself, we may not sometimes be physically dirty, but we wash and do the wudu as, we're commanded to do. And there's spiritual benefit in that itself. So, when we kind of discuss medical things that may, break the wudu, it's not just about the literal cleanliness. There is, the intention and the spiritual benefit that we get behind it and the wisdom behind it. So what breaks wudu? So excretion or anything exiting the private parts, such as urine and feces, impurity that comes out from any part of the body and flows. So, this can refer to menstruation, bleeding of any part of the body. Those are, just in general things that would break anyone's wudu. So the exceptions to this are medical conditions like the one we're discussing today, incontinence, things that you cannot control, that occur chronically, that is going to be considered to not break your wudu. And what is this exception, or what do we do? What's the recommendation? So basically you will treat it as if you don't have that medical condition, if it's chronic and if it's not something you can control. You pretty much do what everyone else would. You make your wudu as you normally would, before doing those things we mentioned, the prayer, reading Quran, performing tawaf. And as with any normal circumstance, if your wudu breaks for a reason that would normally break it, you just refresh your wudu. So even if you are leaking at that time that you're praying, or even after you've refreshed your wudu and you're leaking urine, that is not considered to have broken your wudu. There are specific instructions and recommendations for menstrual and postnatal bleeding that I won't go into because that's like something on its own, I think. However, this recommendation and ruling, like I said, can be applied to other types of medical conditions such as fecal incontinence and anything else similar. Kind of along the same lines of exceptions, I kind of like to insert it like right above this point is, do what you can for prevention, especially if you are younger and you have the mental capacity to do so. We should always take those measures and do our part to reduce or treat the incontinence. So if there's the medication you can take, if, you can do the exercises, or do any of the other recommendations for treatment, always do those first because, God sees our intention and he knows that, we're doing the best we can. So, you don't want to just say, oh, well, I'm leaking and I'm not going to go to the doctor or do anything about it. And that's just that. So, do the treatment where, as we're supposed to, we're supposed to utilize science and medicine. So I believe that's all I had. I think we're taking questions, so I will try my best to answer these. And if I cannot, I will get the answer one way or another, and we can go over that later.
Yeah, thank you so much, Aneesa. That was wonderful. I'm Amber. I am the chair of the IMANA Education Committee. I want to thank everyone for coming on to tune in. I would love for Aneesa to have some time to answer questions, if you will allow us that opportunity. I just want to firstly thank you for clarifying the differences between stress, urge, and overflow incontinence, and also how it differs between gender. I think that you explained it very nicely how this is a part of old age, and that even though this is quite a sensitive topic, it is quite common. And so it's something that it's important that we all have an understanding, and for not just ourselves, but for our parents, our elders, and our community, and for even attending a masjid, and people having this fear of this thing, having an accident, and how we are to go about that. And you did mention how the ruling of wudu and incontinence, it does extend to other rulings And it does for a female, for example, who is dealing with spotting between her periods, that the ruling extends in her case that she is to make wudu, and that if she experiences spotting while she is in the state of salah, that it is considered to be an exception for her. So jazakallah khair for pointing that out. I just had a quick question, which is in regards to Kegel exercises. Can they be used to prevent incontinence in the future? Is this something that for those who are younger and not dealing with this but fear that this may happen, is this something that they can do now as a preventative measure?
Yes, they definitely. They help with a lot. So the same exercise that is used for urine control benefits a lot of different things that people experience. So I think everyone could benefit from these exercises. We tend to hold a lot of stress and tension in our pelvic floor. And that can, lead to constipation. It can lead to what we refer to as vaginismus in women. It can cause frequency and urgency when you urinate. So even if it's, not for leakage necessarily, I think people of all ages can, benefit for, other things. It is a good thing. I think they are good exercises to do for prevention as well, though, because by the time you need them, you already have, a stronger pelvic floor. So let's say for the women who are going through childbirth, working on these exercises to strengthen their pelvic floors will allow them to kind of bounce back a little bit quicker in regards to urine control. And then, just later down the road in life, I don't think it ever hurts, to have that. It's just like exercising any other part of our body. It's good to do it to maintain the strength.
Yeah, so we actually do have two questions. One is, what about if you have slight incontinence? I think if you pass some slight air through the sphincter just as you're finishing wudu, do you need to redo your wudu?
I would say yes. I mean, that counts as, if you've completed your wudu and that happens, I would consider that a break in wudu, and in that case, you would need to repeat it. Now, if that doesn't happen all the time, or it's not like a constant problem, like a chronic issue that you cannot control, that would probably fall under the incontinence type recommendation. I think in general, I would say that you would probably need to make wudu again for that.
No, thank you for that. And then the other question was if there are any foods or dietary patterns that you think people should avoid or promote to help with urinary incontinence?
Yes, so the avoidance is typically what we talk about. There's not a lot of foods or drinks that you can take that would help necessarily. I think the main thing is prevention or avoidance. So caffeine is a big dietary irritant. So coffee, tea, sodas, energy drinks, chai, in this audience, I think would probably be a big one. That can not only irritate the bladder lining and the prostate, it is also a diuretic, so you'll end up producing more urine. Your kidneys will. Acidic foods and drinks, fruit juices, citrus fruits, tomatoes, those should be avoided. I didn't mention this one, but anything that has a red dye, which is an interesting thing that we found some correlations with drinks that have like a red dye, like Gatorade, an artificial dye, that seems to be irritating. Even artificial sweeteners, Splenda, stevia, sometimes, those can also, stevia is not artificial, but sweeteners can also irritate the lining. I usually tell people just drink anything other than water as a treat. So your fluid intake should mostly be water. Anything else is, just once in a while.
Okay, perfect. Thank you. One question that I actually had, Aneesa, was just what are the emotional impact that you've seen from talking with your patients about what they go through when they have this incontinence issue?
That's a really good question. When patients have incontinence, it's an embarrassing thing to bring up and discuss, even when they're in a clinic setting. Sometimes it's hard for people to talk about. It is something that they think they're the only ones experiencing it, affects someone's confidence, especially if they are still, working and socializing. It can, affect, those types of activities, and it can be inhibiting for sure. in certain settings. I've noticed with our older patients, they can be pretty resistant to treatment just because they don't want to acknowledge that it's a problem. So that's very interesting to me. We kind of noticed it with my grandmother. Actually, and they don't want to wear the pads or briefs, they don't want a catheter, but they're leaking a lot, and it's very noticeable. And so it can be difficult. I think you just have to, respect their wishes as best you can, and try and explain why we're using this, why this is happening. It's definitely not something anyone should be embarrassed about. The good thing is there's lots of treatment, so it's not the end of the world. Come in and talk to a urologist, and hopefully they can find a solution for you.
Yeah, no, thank you. We actually have just two more questions too. Is that at what age does the bladder usually get weak?
It's different for men and women. In general, it's going to be probably like 50 to 70. It's not necessarily that the bladder weakens. That can happen. The bladder is a muscle, and that muscle can weaken. A lot of times for women, it can be due to pelvic floor weakening. After menopause, that loss of estrogen, can affect the support of the bladder. For men, a lot of times the bladder muscle can weaken by having pushed against the prostate for years and years, and that can kind of overstretch and weaken the bladder that way. So I would say for women, it's menopausal, postmenopausal, which, that can occur at many different ages, but usually around 40s to 50s it starts. And then for men, prostate enlargement symptoms typically begin around age 60.
Okay, perfect. Thank you. And then the last one, if you could just explain catheter.
So a catheter is a device or a tube that is either inserted into the bladder or applied for men over the urethra or the urethral opening, and it allows urine to drain through that tube. So there's 3 different types of catheters. The most common one goes through the urethra for both men and women, so it's an internal catheter. So that is a tube that goes through the urethra into the bladder here, and it is held in place by a balloon that gets inflated. So urine will drain through that catheter into a bag. And there is a catheter that we do pretty frequently in our clinic called a suprapubic tube. And that is a tube that actually goes into the bladder from the top through the pelvis. So it's inserted surgically. And this is for patients who need to have a catheter long-term going forward. That it's the same action though. It is going to drain the bladder into a bag, the urine into a bag. One thing that I recommend for a lot of our older male patients is called an external or condom catheter. And the good thing about that one is it's because it's external, there's a higher compliance. People don't mind wearing it, and it's good for nighttime usage because it prevents elderly people from getting up and going to the restroom. That can actually result in a lot of falls, which can be very, very bad at that age. So a catheter is basically a device that drains the bladder.
Perfect, thank you. And then, and so the last question we'll take for now. So, is it good to drink a lot of water to keep the area healthy instead of Coke or sugary drinks or orange juice?
So yes, you should definitely have more water intake than the other things. The answer to drinking a lot of water, I don't tell people to overdrink. There is a such thing as drinking too much water. So the recommended amount is, 60 to 70 ounces a day. Some people do have restrictions on how much water they can drink if they have certain medical conditions, like congestive heart failure. So don't overdo the water, drink an adequate amount. I think in general, most people don't drink enough water. So that's why, you always hear drink more water, but 60 to 70 ounces plus more if you're going to be outside, exercising, sweating. I would say anything over 100 ounces is probably quite a bit, and your body doesn't need it. But it is important for prevention of, urine infections.
Thank you so much, Aneesa. That was very informative. I think one thing that I think many of us are going to walk away from with this is that it's quite common, but it's sensitive. But you mentioned that there are many treatments available. And so if you or someone you know is dealing with this, that you don't have to live like this, that there could be a treatment, an easy treatment available for you in order to control this. And I think, lastly, for any of the physicians or medical professionals that are listening, that it would be a simple advice to maybe ask your patient in order to take away the discomfort, as it is something that's difficult to bring up. And so something that you can ask your patient if this is something they are dealing with, and allow them to understand the different treatments so that they don't have to, deal with this discomfort. But I want to thank you so much for taking your time. And for those who are listening, we will go ahead and end the session. If there's anything else you wanted to add, Aneesa, please feel free. But thank you so much. And also, this session is being recorded. So if you are interested in listening to it later or sharing it, we will be posting it on the IMANA Education site for you to view and listen, or for you to view and listen to others. But thank you so much, Aneesa. We will go ahead and end with Surah Al-Asr. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. By time, indeed, man is at a loss, except those who believe, who do righteous good deeds, and who recommend one another to the truth. Jazakallah khair to you all. We look forward to having you at our future webinars this summer. Assalamu alaikum wa rahmatullah.
Thank you so much. Walaikum assalam.